Understanding cardiac risk factors. This presentation should be used for general information purposes only. It is not a substitute for specific medical advice from a GP, specialist, or other healthcare professionals and should not be used as such. For individual cardiac rehabilitation advice, please consult your local cardiac rehab team. If you're experiencing any changes in symptoms, please seek advice from either a GP or specialist. In the event of severe chest pain or breathing difficulties, please dial 999. Hello and welcome to this video on risk factors. When we talk about cardiac risk factors, there are two types. There are modifiable risk factors, which are risk factors you can do something about, and there are non-modifiable risk factors, which are ones you can't change, but it is still important to be aware of them. Firstly, we will look at non-modifiable risk factors. These are the ones you can't change and include family history, gender, and age. So, if you have family history of heart disease, you may be more likely to experience the same. With regards to gender, we know that heart disease tends to affect more men than women. Women are more protected by their hormones, but when they reach the menopause, the risk tends to even out. And lastly, there is age. We know the risk for angina and heart attacks is greater for people over the age of 40. Now, let's take a look at the risk factors we can do something about. On this slide, there is stress, smoking, lack of exercise, and excessive alcohol levels. All the risk factors on this slide and the next can affect your long-term heart health in different ways. It is important to try to identify any risk factors which you think may have contributed to your heart disease, and then take steps to make healthier lifestyle changes. Some people will identify a couple of risk factors, and others only one or even none. If you do have a number of risk factors, try to prioritize which one is most important to you, as trying to make too many changes all at once can become very overwhelming. On this slide, the risk factors include weight, type 2 diabetes, high blood pressure, unhealthy eating, and high cholesterol. For all the modifiable risk factors in this video, please see our separate presentations for more detailed information on the ones you feel are appropriate to yourself and the ways in which you can manage them. Goodbye and thank you for watching.